All right, everyone. Thank you so much for joining us today for this researcher roundtable. I am Tracy Chubik. I am the Director of Operations at the Leonard Davis Institute for Health Economics. And we have convened this roundtable today to discuss NIH administrative supplements to promote diversity in health-related research. And we are lucky to have two terrific presenters from two NIH institutes who I will introduce shortly. A little bit of context to this roundtable. Substantial funds are available from the National Institutes of Health and the Centers for Disease Control and Prevention for administrative supplements to enhance the diversity of the research workforce by recruiting and supporting students, postdoctorates, and eligible investigators from diverse backgrounds, including those from groups that have been shown to be underrepresented in health-related research. This resource is often underutilized, and many eligible principal investigators and potential candidates for support are not aware that this funding mechanism is available. And so we're hoping to remedy that today. The plan for our time together is to have two presentations from our speakers, followed by a Q&A session. We look forward to a robust conversation and hope that everyone comes away from today's event with a much better understanding of why these supplements are important, how to submit a competitive application as both a principal investigator and a candidate for support, and some institute-specific clarification about what happens after you apply. So, without further ado, I am thrilled to announce our two guest speakers. We have Dr. Maria Carranza, a training officer in the Office of Strategic Extramural Programs in the National Institute of Aging. And we have Dr. Dottie Castile, training coordinator and senior program official in the Office of the Director for the National Institute on Minority Health and Health Disparities. So Dr. Carranza will be presenting to us first, so I'll go ahead and turn over the floor to her. Thank you all.
Thank you very much, Tracy, for the kind invitation, and it's a pleasure to be with you here today. I'm going to share my screen. Excuse me. And I'll go ahead and start the presentation. So once again, it's a pleasure to be here with you today. I'm going to be speaking to you about diversity supplements from the National Institute on Aging's perspective. So I'd like to make the disclosure right away that even though this is an NIH-wide initiative, each institute at the NIH has their own rules and specifications that they apply to this tool. So I will be speaking on behalf of the NIA, and my colleague, Dr. Castile, will be speaking on behalf of NIMHD. So for anyone who is interested in a diversity supplement, it's very important that they become aware of their own institute's rules and regulations related to the diversity supplements. So very briefly, today I'm going to give you an overview of what are diversity supplements and why should principal investigators seek them. I'll also go over the application instructions and some common issues that we find. And I'll end by mentioning a few other supplements that you may wish to be aware of and ways to connect with the National Institute on Aging. Very, very briefly, I'll also mention that NIA supports a wide variety of training and career development opportunities for students, early career investigators, and clinician researchers, both at the individual and institutional levels. But today we will focus on diversity supplements, which are a very important training and career development tool, and as I mentioned, also other supplements of interest. So let's begin this conversation by right away stating why seek diversity supplements, right? So the first reason for a principal investigator would be that this is a way to expand the aims of the parent grant. And then this is also a very important and often underutilized recruitment tool for bringing promising emerging investigators from backgrounds underrepresented in biomedical and behavioral sciences into your research laboratory or setting. And then, as this is a training and career development opportunity, this opportunity will provide protected research and career development time for that promising investigator, allowing them to advance and progress towards research independence. So let's talk about what is a diversity supplement. Okay, so at the National Institute on Aging, our goal is that this program support the development of eligible trainee candidates who are specifically seeking independent and productive careers in research on aging. It is also very important to make the distinction that diversity supplements are not grants. As Tracy mentioned, these are administrative supplements that are tied to an existing and active parent grant. And because they are not grants, diversity supplements cannot be transferred between institutions, and they cannot be used for anyone else other than the named candidate in the application. And again, the goal is to add funds to an existing grant to recruit and support the development of scientists from underrepresented backgrounds in biomedical research. So I'll be going over a few of the elements of NIA diversity supplements. And again, these are details that pertain only to my institute, the National Institute on Aging, and these will be different for every institute at the NIH. But at the NIA, we accept applications on a rolling basis, and applications are reviewed within 2 to 3 months of receipt. And importantly, applications that are seeking consideration for the summer and anytime before September 30th of any year, the application must be received by NIA by May 1st to ensure consideration. It's also very important to note that independent or ancillary clinical trials are not allowed through a diversity supplement, even though experiences within the parent's clinical trial conducted by the mentor or co-mentor are allowed. In terms of the parent grant, the eligible parent grants are comprehensively listed in the funding announcement, and NIA actually does accept applications from all of these different types of parent grants. Importantly, the parent grant can support more than one individual on a diversity supplement. However, a separate application is required for each candidate, and each application will be evaluated independently. In terms of the principal investigator, it must be the PI or the contact PI of the parent of the active parent grant. And for multi-component grants, the overall contact PI needs to submit the application on behalf of the project PI from their own institution. In terms of the candidates, the focus is on individuals that are from groups that are shown to be underrepresented at a national level in the biomedical, clinical, behavioral, and social sciences. And at the NIA, we accept applications from all career levels of candidates, from high school students to undergraduates to postbaccalaureates to graduate students and eligible new investigators. Importantly, diversity supplements are available for established investigators who are or become disabled to support reasonable accommodations for that PI. Another important component is that the candidate must be a US citizen or permanent resident to receive this award. The award budget varies based on the career level of the candidate, and the typical award duration is 2 years or less. In terms of the application content, here are the list of components that are expected at the NIA. And these include a research strategy with a limit of 5 pages, biosketches for the for the candidate, the primary mentor, and any other co-mentors proposed. Also, a candidate eligibility statement establishing the eligibility of the candidate for support under this program, which must be signed by both the PI and an institutional official. Then also candidate transcripts for students only, not for postdocs or eligible faculty. And then letters of support are optional. In terms of the 5-page research strategy, NIA expects that it will include a research plan with sufficient detail for the committee to evaluate the merit of the scientific proposed plan, but it should also contain a training and career development plan that is detailed, specific, and tailored to that individual candidate and their career stage. And this should include specific plans for grant applications appropriate to the candidate's level, courses, conferences, manuscripts that the candidate will co-author, and any other items of professional development that the candidate will have available. In addition, there should be a detailed mentoring plan that includes the details of the interactions planned between the candidate and the mentor or mentors and the research team, and also describing the specific role and expertise that each member of the mentoring team will bring to the table. As mentioned earlier, bio sketches are required for both the candidates and the mentor or co-mentors, but it's really important that these be personalized. So NIA expects that the candidate will include their personal statement, typically in section A of the bio sketch, where they describe their goals, their future goals in research, and how this opportunity will facilitate their immediate, near-term, and long-term goals. Very specifically, NIA is interested in supporting individuals who seek careers in research on aging. So NIA expects that there will be an explicit mention of aging research in the career plans and goals of the candidate. In terms of the mentor's bio sketches, again, in the personal statement, details should be provided about the mentor's track record in mentoring individuals at this same career stage and background, and then also specifics about what they will be providing to this particular candidate and their role in coordinating the mentoring plan for the candidate. In terms of the candidate eligibility statement, this is a required component without which the application will not be considered for funding, and it should contain 3 pieces of information. First, very clearly stated information on the citizenship of the candidate. Then, specific information on the nature of the candidate's disabilities, circumstances, or backgrounds, or otherwise characteristics that confer eligibility for this program. And then a description of any current or previous public health service or PHS research grant support. Even if the candidate has not been the principal investigator on a grant, we need to know details about what are the sources of federal support that this candidate may have received. And this is extremely important because eligibility based on PHS support will determine whether this application is forwarded for review or not. Specifically, candidates receiving continuing PHS support, including having been supported by the parent grant, are generally not eligible for a diversity supplement. Candidates who are currently appointed to an institutional NRSA award, such as T32, T35, are eligible once they have completed the term of their appointment and not before. They may not be transferred to supplemental support before the end of their appointment. So these details specifying current PHS funding should be included in the candidate eligibility statement. Moreover, because they determine the eligibility of the candidate, individuals interested in a diversity supplement are encouraged to reach out to us specifically. You can reach out to me if your parent grant is from the NIA to discuss the PHS funding details of the candidate and whether or not they are eligible before you spend the time and effort in submitting your application. In terms of the budget varies depending on the career level of the candidate. And these details are very well specified on the NIA Diversity Supplement website. But the important point about this is that salary and fringe benefits, supplies and travel, and tuition where applicable for the candidate only are the only budget categories allowable under diversity supplements. The candidate career level will determine the budget caps for these costs, but no other direct cost line items in the budget will be covered per the program announcement. Research costs are generally expected to be supported from the parent grant. As mentioned earlier, typical supplement support is for 2 years or less. And the only exception is for investigators who can seek either short-term training during the summer for full-time 3 to 5 months each year, or long-term support of up to 2 years, devoting 75% of their effort to the supplement activities. In all cases, it is expected that the application will propose a very detailed training and career development plan for the candidate with stated milestones and a mentoring plan and career development plan to achieve those goals. Returning to the budget, examples of unallowable costs are listed here. In terms of equipment, so equipment is not covered, publication costs, consultant services, and all of the other types of costs that are listed here. This includes human subject patients or research incentives. These are not covered under a diversity supplement budget or transcription services. The only exception here is equipment when it is related to reasonable accommodations for a PI who is or becomes disabled. And this equipment is necessary and essential in order to fulfill their role in the project. So if this is the case, please contact us for specific instructions. Additional examples of unallowable costs are also listed here. Animal costs, lab fees, preparation courses, memberships, again, participant incentives, or even health insurance that is not included within the fringe benefits. Health insurance is covered, but it must be included in the fringe benefit line, will not be supported under the diversity supplement budget. As mentioned earlier, research costs are expected to be supported from the parent grant. Other information that is important to provide as relevant is whether or not the research will be conducted at the site of the grantee institution or whether it will be a subcontract at a different institution. This is perfectly allowed. However, details must be provided of this agreement between the two institutions. For a supplement based on disability, whether for the candidate or the PI, the institution must indicate what, if any, reasonable accommodations have already been provided to the candidate or PI to fulfill those accommodations. And then candidates sometimes are eligible to apply for a second diversity supplement. In their case, candidates need to outline clearly in their biographical sketch their accomplishments during the first supplement period and the reasons which have to be compelling for a second diversity supplement request at this later stage in their career. In terms of review and funding, as mentioned, NIA accepts applications on a rolling basis and reviews them in a monthly cycle. The typical timeline from submission to award is 3 to 4 months. Applications are reviewed administratively, that means within the NIA by the NIA Diversity Supplement Committee. And then the review outcome often includes a summary statement with written feedback. And funding decisions are made based on the merit of the application and the proposed both research and career development activities. Also on the potential of the advancement of the candidate towards research independence. And then, of course, the availability of funds. Unsuccessful applications may be resubmitted once. So some common issues that we see with diversity supplements, and I am the co-chair of the NIA Diversity Supplement Committee. So some common issues that we see is a misalignment of goals. And whether it's not clear that the candidate has an interest in aging research or whether their stated goals in their personal statement have nothing to do with what is being proposed in the application. Again, not enough aging focus for us. This is extremely important. Or whether there is no independent research plan. Depending on the career stage of the candidate, a greater degree of research independence is expected, even though the plans must be within the context of the parent grant. An independent research plan for the candidate is expected. Not enough detail in the training and career development plan. Not enough detail on the interactions between the candidate and mentors. No clear timeline for the research, training, and career development activities. In fact, we recommend that applications include an integrated timeline with these three aspects included in the table, so that the committee can clearly see how the connection between the training and career development activities with the research activities, and how this will all be achieved in the context of the time proposed. No clear pathway to independence in terms of grant applications. Again, NIA expects that diversity supplement candidates will progress towards research independence, and this means, in many ways, obtaining their own research grants. Not submitting full year budgets. Full year budgets must be submitted. And then unallowable costs included in the budget upon which the training and career development activities depend upon, and without which they will fall apart. So the bottom line, so overall, if it is unclear how the proposed plan benefits the candidate above and beyond what they could have achieved without the diversity supplement, or how the proposed plan will help develop and launch the candidate's independent career as a researcher, the supplement will not be recommended for funding. The bottom line is diversity supplements are all about the candidate and the candidate's path to independence in research on aging. So to end, I would also like to mention two other types of supplements that are important to consider. And one of them is the reentry and reintegration supplements, which allow PIs to recruit and support individuals with high potential to re-enter or reintegrate their research careers after an interruption. And then also continuity and retention supplements, which are available for individuals who currently hold a K or Career Development Award, or who are first-time recipients of a research project grant. If these individuals are facing critical life events, which are denoted in the notices, these type of supplements will provide support to aid in the candidate's research during that critical life event, and this takes the form of additional personnel, computational services, or supplies and equipment, again, to help support the PI's research during that critical life event. So finally, I would like to end the National Institute on Aging's portion by encouraging you all and trainees who may be interested in diversity supplements or any other training and career development opportunities from the NIA to keep in touch with us. My colleague, Dr. Jamie Lavick, and myself are the two humans behind the NIA training mailbox that you see here, and we will be delighted to provide you with guidance and point you in the right direction. We also invite you to explore our website, to sign up for our NIA training newsletter for up-to-date news on NIA training and career development activities, and also to sign up for our blog. And with this, I will turn things over to my colleague, Dr. Castile.
Thank you so much, Maria, Dr. Carranza, and thank you, Tracy, and to Penn for the invitation. This is a lovely opportunity to meet you and to be included in your activities. I'm going to start by sharing my screen. I hope that this will work, and that eventually that bar will go away. If anybody has a tip on how to do that, please let me know. I don't know how to make it go away, but can you see?
Good, Dr. Castile. Yeah, we can see.
Okay.
Yep.
Okay, great. All right. I'm going to take a little bit different approach. As all of you know, the NIH is a large corporation comprising 27 semi-autonomous business units, and they vary in size and in age, from well over 100 years to just a little over 10, and that would be how old the National Institute on Minority Health and Health Disparities is. We are one of the youngest institutes at the NIH and one of the smaller institutes. So there are some differences in the range of activities that we support and how we do that. And you'll see that a little bit in my presentation. However, I do want to say what a privilege it is to present with my colleague, Dr. Carranza, because we also learn things from each other, and it's a great opportunity for that. I would like to familiarize you a little bit with some of the information on the NIMHD website about NIMHD's mission. the legally defined mission that established this as an institute. And that is that we support research in minority health conditions and in the underlying causes and what can be done about health disparities, not just differences, but differences that have a negative health outcome. We are disease agnostic in that we look at all disease outcomes, including comorbidities and endemics. And we look at those issues through the life course. On our website, you can find the strategic plan. Not only are we responsible for developing a strategic plan for our institute, but we hold the responsibility for developing an NIH-wide strategic plan. And there are links on this webpage to that kind of information. So prior to applying to any institute, one of the things that you may want to do as an applicant, and I would encourage you to apply to more than one institute, because no good business person sells their wares to only one buyer, would be to check out the focus of the institute that you're interested in applying to. The vision is that we will have an America in which all populations will have an equal opportunity to live long, healthy, and productive lives. And our mission is, as I said, to lead scientific research to improve minority health and eliminate health disparities. We serve a very specific group of legally defined health disparity populations. And we have a number of activities through the career development course, but these are some of those that are specifically training focused to help us train and prepare a diverse scientific workforce, and then to be able to conduct research and translate and disseminate that research to foster collaborations in communities and across various business entities across the United States, other federal agencies, as well as for-profit and not-for-profit entities. We really seek to understand the underlying causes to reduce health disparities, and we conduct research in that is included in a number of trans NIH initiatives, and these are some of the many initiatives that we participate in. The most recent of these for participation are the Radical Acceleration of Diagnostics in Underserved Populations, which has focused on testing in underserved populations. The SEAL program, which was a community collaboration effort, our alliance to protect against and prevent COVID-19, and then COMPASS, which directs fundings directly to communities to conduct research focused on their own community needs. I'm going to go on to the next one area that you can find articulated and publicly available, the scientific mission of NIMHD, including a very important document that grew out of our director's tenure as a council member on the NIA National Advisory Council, and that is the NIMHD research framework. There is a National Institute on Aging research framework as well that you might want to have a look at. NIMHD is concerned with looking at the causes and the areas at which we can intervene on health disparities at the individual, interpersonal, community, and societal levels, and also in domains of influence, whether that's biological, behavioral, the physical built environment, sociocultural, the healthcare system, and this is over the life course. And this reflects as well how we arrange our divisions, our scientific divisions, and we can talk about that at another time if that's of interest to you, but I'm not prepared to talk about it now. Regarding career development and training programs, these are the opportunities at NIMHD and our overarching webpage for your reference. I will, while I speak right now only about diversity supplements, we have a very well-developed loan repayment program and many other opportunities for training through the life course. Specifically, Dr. Carranza really covered the overarching philosophy of the NIH around diversity supplements and the NIA philosophy very well. I would like to use some of these slides in my time to point out some of the differences between our institutes and our institutional focus. While NIA focuses on career development through the life cycle from high school through early stage investigators and beyond. NIMHD strongly prioritizes postdoctoral fellows and junior faculty level candidates, that is, those candidates who have not yet received R01 funding. And this is a strong limitation of what we fund, a strong focus of, not limitation, but a focus of what we fund. So please be aware of one other thing. You can only submit a diversity supplement where you have a parent grant. So if you have a parent grant, but you're at NIA and you're interested rather in submitting a supplement to NIMHD, you would need to be funded in a parent grant at NIMHD to submit that application for our mission. Now, all institutes and centers across the NIH are mandated actually to support research and support for a diverse workforce. So every institute should be open to that, but I just needed to let you know that you have to align with the parent grant that you're submitting through. We also have a diversity supplement website that walks you through a lot of the information that Dr. Carranza went through, and I will go through a little bit, but again, it's mostly to point out the differences because my colleague did such a beautiful and thorough job of that. The two current announcements that are on the street that were talked about, I don't know why I have an underline in that, a scratch through, but these are hot linked and they are will take you to the notice of funding opportunity. Please pay attention to that. Dr. Carranza walked you through all aspects of it. It does yourself a favor to read it more than one time. This is the diversity supplement, as Dr. Carranza pointed out, is one of the fastest ways to get money to a diverse scholar, but it's also a very nice step up, and it can be a step after your postdoctoral fellowship. It can be a step as an early stage investigator coming into a new position in a university. In addition to that, this is the link to the reentry and reintegration notice of special interest that Dr. Carranza mentioned earlier. For our, this just goes into greater detail, and I want to add one comment to the individuals that are identified as diverse populations. For NIMHD, these are legally defined. They include in racial ethnic categories, Blacks or African Americans, Hispanic or Latinos, American Indians or Alaska Natives, Native Hawaiians, and other Pacific Islanders. In addition, we focus on individuals from rural or disadvantaged backgrounds, and those individuals need to meet 2 or more of the criteria listed in the notice of NIH's interest in diversity. You need to see that notification and read it carefully when you're developing your candidate eligibility statement. Most recently, since the last National Advisory Council, an additional population has been added to our health disparity populations, and that is individuals with disabilities, or those individuals who are defined as having a physical or mental impairment that substantially limits one or more major life activity. And these life activities as described in the Americans with Disabilities Act of 1990 as amended. So again, you need to look at those things. I'm happy to meet with you and to talk to you about it. But research, efforts to support individuals with disabilities, but also we support research in disabled populations. That's a new area added for NIMHD and for NIH, for that matter. We strongly encourage this. It's money left on the table if you don't do it. And the candidate for NIMHD does not have to be at the same institution as the parent, the PI of the parent award, but you must carefully describe exactly how and when and what the work product will be for interaction with your mentors. And I usually say that a mentorship team equals greater than 2. You need to have as many mentors as you need to support the development in the areas that you need to advance your career. this is just a recap of the areas that Dr. Kranza has already spoken about with page limits, which I thank her for. And again, our focus is on postdoctoral and early stage investigator. That's there. There's a legal definition for that. We also will not review incomplete applications. They'll be withdrawn without review. Let's see. We offer no more than 2 years of support. We do respect the short and long-term plans that Dr. Kranza mentioned. We do not supplement some funding opportunities. I noticed that there was a question in the comments about whether this service applies to a K award. K awardees actually are eligible PIs, I believe, on the and Maria, please correct me if I'm incorrect about that. Are they not eligible to apply for a diversity supplement?
No.
They're not. Okay. So if you're on a K award, you can't apply as a PI for it, but you also can't apply for it for yourself until the award is over. Is that, am I correct about that? Please correct me. I may be incorrect on that. It may be something that we need to clarify internally as well. So.
Sure.
Go for it. Did I state it incorrectly? You might want to adjust it.
Sure. Individuals who have already received grants, in their own name, including career development awards, individual career development awards are generally not eligible for diversity supplements.
Thank you.
But this does not include institutional career development awards like the KL2 or the K12 that was mentioned in the chat. Okay, they are eligible once their appointment ends. Thank you.
Thank you. We don't do KL2, so those are not an area that with which I'm familiar. We do not supplement 2-year R03 or R21 awards, and you have to have at least 2 years left on your grant for us to consider funding it. And then these funding limits are the same as what Dr. Kranza mentioned. For us, we have specific submission dates and review times and estimated award dates. However, that award date could go longer than these dates that are estimated here. So if, and I agree with Dr. Carranza's suggestion, if you expect to get funded before the end of the fiscal year, which ends at the end of September, submitting prior to the June 1st submission deadline is a really good idea. I think that's about it. I do want to mention a couple of other things, though. Individuals who on the parent grant have supported diversity supplements. And Maria, if I'm stating this wrong, I believe I have it correctly, but if you've supported a diversity supplement on your parent grant, you are eligible, and a young investigator and an early investigator, that is, this is your first R01, you're eligible for a very interesting mentorship supplement that really supports you in learning and in being able to provide greater mentor activities and to develop your skills as a mentor. I would strongly encourage that you look at these mentorship supplements. This particular notice out of the Office of Equity, Diversity, and Inclusion, led by Dr. Marie Bernard, has sunsetted. It's my understanding that it should be renewed. I would keep an eye on that, and you can find that at the DEIA Mentorship Supplement webpage, but also by subscribing to the NIH guide, and I'll give you more information about that shortly. And it really supports scientists who are outstanding mentors and who've demonstrated compelling commitments and contributions to enhancing diversity, equity, and inclusion in the biomedical sciences. Others of you who are submitting R01s, who are young investigators who would like to be considered for this DEIA mentorship supplements, please consider submitting a 1-page statement of your support for equity, diversity, and inclusion in your application. It's mentioned in the DEIA supplement notice of award, and it's something that you should be aware of and pay attention to. It's leaving money on the table if you don't take advantage of that opportunity. I would also like to mention a couple of training opportunities at NIMHD that are a training opportunity, and that is the Health Disparities Research Institute. This opportunity, which we run every year, it's 1 week on the NIH campus, and transportation to the NIH is paid for through NIMHD, while your stay here is paid for by yourself. It's a week-long intensive and engaging training experience, and it allows you to understand different aspects of the grant application process. You meet with review officers and have the opportunity to attend a mock review. You have an opportunity to meet with NIMHD program officers as well as program officers across the institutes based on your scientific interest. The application period generally opens in February and closes in March. It is a competitive process, and this is the link to the information that you need to prepare for that as we are getting ready to open up for the next season. You also have opportunities to receive one-on-one consultation about F, K, and R application submissions. We would love to have your application and to see you in our cohort, and so please reach out for more information. This is our webpage, and these are just a slight recap of what we talk about and do in the Health Disparities Research Institute. I want to encourage you also to sign up for, if you have not already, and subscribe to the NIH Guide. This is the NIH Guide webpage, and this is the link to it. If you want to do it before you get these slides, you're totally welcome to just hit in Google NIH Guide subscribe, and it'll come up for you. So that's there. This is how you can reach me and my colleague, Ms. Lihir Artiles, who works with me on this. And I'm happy to take any questions. And I noticed that there were some in the website, some in the chat.
Yes. Thank you so much, Drs. Carranza and Castillo. Those were great presentations, so helpful. And I am pleased to let everyone know on this call that both Drs. Carranza and Castillo have agreed to share their slides. And also we will be posting a recording of this session on our website. So all of you as registrants and attendees, I will make sure that you get access to these materials so that you can have all the hyperlinks and can refer back to this information when you're hopefully pursuing your own applications. So we do have some time, and I'm excited to facilitate a Q&A with our guests here. I actually just wanted to start with one myself, and then I promise I will get to the ones in the chat and the Q&A function. Something that comes to mind for me is that given the differences that you noted regarding the processes for your respective institutes, which application elements should potential applicants pay special attention to, given the higher likelihood that there are differences between institutes and agencies?
I think I can start, and then I hope that you will chime in, Maria. I think the most important part is to identify the institute you're going to submit to, and know the mission of the institute that you're planning to submit to. Clearly for a candidate, you can get into that process in two different ways. A candidate can approach a principal investigator that they're working with, or whose work that they admire and like and want to be a part of, or an investigator can identify a candidate. And so in either case, the institute is identified by the parent grant on which the person is applying. But for the candidate themselves, you can also find people who are working in an area that is of interest to you, to whose work you may like to contribute in some way by using the NIH Reporter and searching for your area of interest in NIH Reporter, both at your university at Penn or at some other university that might be a better fit. I'm happy to work with you on using the NIH Reporter. Maria, did you have more to add?
Yes, I would encourage everyone to assess eligibility. Since you asked for one thing to look at first is eligibility.
That's a good point.
A of the parent grant So contact your institute of choice, to see whether your parent grant is eligible, whether it has still enough remaining time on the parent grant in order to support a supplement. And if it's one in the list of supported programs, as Dr. Castile mentioned, NIMHD supports some research project grants, but not all. At NIA, we support all the different activity goals. So first, eligibility of the parent grant, and then eligibility of the candidate. So there are questions about eligibility. I would encourage everyone to take a look at the eligibility criteria, both in the Diversity Supplement Program announcement and the NIH's Notice of Interest in Diversity. And these have the details that are necessary for assessing eligibility, as well as contacting the point of contact at your institute. If it's at NIA, it will be me, and I can answer the question, based on the specifics of the grant and the candidate in question. And this also includes whether the candidate has been supported or is being supported by a public health service grant, right? And this will also determine whether the candidate is eligible or not. So eligibility, first and foremost, of the parent grant of the candidate. Before anyone spends any time and effort in developing the application, you want to make sure that you are within the parameters of your desired institute.
Great, thank you. So I'm going to start taking questions out of the chat now. We have I think all three of us mentioned how these administrative supplements tend to be underutilized. Dottie and Maria, how do you think that institutions can help support investigators in understanding that these supplements are available and encouraging applications?
So it goes both ways, right? So first, just knowing that the diversity supplements are an NIH-wide initiative, right? So they are supported by every single institute within the 27 that were mentioned by my colleague Dottie, and so they are available, right? So then making an effort, to identify and match, institutions can play a role, and maybe certain offices within institutions can play a role in matching, PIs with eligible candidates, and make sure that their interests match, because this really has to be a genuine match, not just, it really has to be genuine, because that you can read that in an application. And then I would say that the ideal application is written by the principal investigator in close collaboration with the candidate. So in order to make sure that, again, there is a genuine match between the candidate's goals and what is being proposed in the supplement. So
I think that there, now I've forgotten the question, but I had something to add to it. Can you repeat the question, please, Tree?
The question is just how institutions can do better at making sure people are aware.
Well, institutions like Penn can do just exactly what this seminar is, which is you can reach out to us. None of us that I know of have developed clairvoyant properties, so we can't tell when we need to talk to you. You need to let us know. And I can speak for myself. I can't speak for Maria, but I've done a number of webinars with universities and with different groups within universities for a number of different reasons, for exactly this purpose, to answer specific questions on specific funding opportunities that are available. So, we're available to help you. You just need to let us know.
Thank you both. So we had another question that asked, can you put out a call for people to apply for the supplement with the position contingent on getting the supplement? Or does it have to be someone who is already in a training program or something of that nature?
The candidate has to be identified, because there has to be a candidate eligibility statement in the application. And it has to state that the person is a US citizen and what their eligibility criteria are based on the notice of the funding opportunity announcement, but also the notice of NIH interest in diversity. So that's that you can't, it's not a post hoc thing. You have to do it at the beginning. And I really strongly recommend, if you're submitting an R01 or a grant on which a diversity supplement would be eligible, to consider that very close on the heels of getting funded if you're not already considering it.
Yeah, so I would just stress, just like Dottie said, that as opposed to research project grants, candidates cannot be TBD, to be determined. It has to be a named candidate. However, if the principal investigator wants to put out a call to identify potential candidates before submitting the application and then developing a tailored application for the candidate or candidates that are identified, that's entirely up to them. And NIH will not prescribe, what is done in terms of the matching. But once the application is submitted, it should be a tailored and specific application to a particular candidate.
Thank you. So we had a question in the chat. If are women considered underrepresented and qualify? Do they qualify for diversity supplements?
Maria, you want to go for it?
Okay, so I encourage everyone to take a look at the eligibility criteria that I stated in the program announcement and the NIH's notice of interest in diversity. So in general, women are not considered underrepresented at a national level, at the graduate school level, and below. In fact, women are the majority, at the undergraduate level in biomedical research in general, but they may be considered underrepresented at the faculty level. So it really depends on the circumstances. So again, I encourage everyone to go to these documents in order to look at eligibility. In addition, NIH's notice of interest in diversity contains examples of populations that are underrepresented, but also very clearly states that NIH acknowledges that underrepresentation varies from setting to setting. So it's up to the institutions to identify candidates that they can convincingly propose as being underrepresented in biomedical research as potential candidates for this program.
Thank you. And then we have one more question. You have already addressed this somewhat, but it's kind of asking about the cross-institution permissibility. So if a PI who submits, does the PI who submits a candidate have to be a PI at the prime institution on the parent grant, or can a co-investigator submit who is not at the primary institution?
So it's always the PI or the contact PI of the parent grant who has to submit the application, even if the application is on behalf of another one of the PIs. And even if the research and the diversity supplement will go to that other institution, it's the contact's PI responsibility to submit on behalf of that second PI and that candidate. And they can be two different institutions. That's perfectly allowed. That's called a subcontract application, and it's done all the time. And NIH just needs details about the arrangement between the two institutions, and two sets of budgets will be needed, one for the parent institution and one for the recipient or subaward institution.
Thank you. I believe that I have caught all of the questions that have been submitted so far. If I have missed anyone, or if there's other questions out there that you haven't yet hit enter on, please do. I'll give folks a moment to submit anything further.
Tracy, I do want to make a comment. That's the difference between what may be at NIA. I'm not entirely sure or not. But someone asked, or Maria made a comment that more than one application could be submitted at a time. At NIMHD, a grant can have more than one diversity supplement, but it's not wise to submit them in the same submission period because they'll be competing against each other. We are a much smaller institute than NIA, and our funds are much differently managed. They have a committee managing it, and it's it's managed differently at NIMHD. Similarly, but there are nuanced differences. So I think you need to think about it strategically, depending on who you're applying to, which is why you talk to us, And talking to a program officer early is advised. Waiting until the week that the application is due is probably too late.
All right, so we did have a question come in. So are applicants evaluated based on scholarly productivity in terms of how many articles they have published?
I think that that's one of the criteria, but not the whole picture. You know, one of the things that young investigators frequently do is that they don't mention some things like a low publication record and what they're going to do to address it in their applications or in their personal statement. If you have something that, if you've had a disruption in your career or some other thing that has caused you to not have as much research focused change, not to be as productive as you would have liked, address it. Say, my publication in XYZ area is low. These are the activities that I'm planning to address that gap. I mean, that's one thing you can do. It may not be the overall picture, but it's one thing. Maria, do you have other ideas too?
Absolutely. It's one of the components, but the application is viewed holistically.
Right.
In fact, I would say that that's exactly what the diversity supplement is for, is to afford the candidate with protected research and career development plans so that they can increase their publication record so that they can then submit competitive applications of grants, in their own name, be it that a fellowship or a career development award. So actually, this could be part of the statement of the need for this diversity supplement, is to allow for the candidate to enhance this particular area of their productivity, which is not the only area of productivity. It's assessed holistically. Thank you.
Yeah.
Tracy, there's a question, not to skip over anyone,
Yep.
but there's a question here about links and resources and serving on related committees. I'm not sure if that's serving on review committees, because extramural scientists can serve on CSR review committees and institute-specific review committees, but not on these particular applications. These are intramurally or within the institute reviewed.
Thank you for catching that. Yeah. Great. So shifting gears a little bit to another type of supplement that was discussed, the reentry supplement. Can a reentry supplement be used after a voluntary departure from research? For example, if you were to go into consulting for a couple of years after your PhD and then tried to come back to research, could that supplement be used for that purpose?
So the reentry supplement notice lists the specific reasons that are considered eligible for those departures. So I would say it depends on the circumstances and what are some of the other circumstances surrounding that voluntary departure. So it's possible, but please contact the agency contact of the institute in question to which you wish to apply for so that we can clarify that for you specifically.
And I would say, look at the reasons. It's in the notice. A lot of what we do is law governed, and so that you need to know what those laws are, just like we do.
And there's another question in the chat related to success rates. The exact list of diversity supplements that are funded by each NIH institute per fiscal year is publicly available on the NIH reporter. Okay, so and the success rates may vary from institute to institute, but you can see that if you look at NIMHD or NIA, you will see exactly how many supplements we funded in a particular fiscal year. So I will just say that success rates are high. They may be higher than for some of the other, grant opportunities. So I'll just leave it at that, and you can check it out on your own for the specific institute you're interested in.
Well, I think that's a little bit. So I like to make one adjustment to that question, because you know who's successful, but you don't know how many people applied.
Exactly.
And we can't give you that information.
That is the reason why we can't give you success rate, because the number of applications is not public information, but the number of awards is, so you can check those out.
Yeah, Get to Know Reporter is a terrific tool. It's really a terrific tool.
Great. Well, that hour went really fast. So thank you again to both of our presenters, Dr. Carranza and Dr. Castile. We greatly appreciate your time today. And again, everyone here on this meeting, you will get all the materials that were discussed today. I'll make sure that those are provided to you. And I hope that you all feel very empowered and inspired to pursue these supplements. So thank you everyone for being here today. Have a good weekend.
Thank you.
Bye.
Bye.